Hi, this is Daniel, Nate, and Caitlin presenting our research on the exploration of the impact on weight loss in overweight asthmatic individuals. The PICO question we created: in regard to overweight individuals with asthma, does weight loss reduce severity of asthmatic symptoms compared to those who do not lose weight?
Now, a somewhat brief introduction. Medical conditions such as asthma and obesity have profound impacts on quality of life, ability to perform activities of daily living, and the ability to function effectively in the workplace, especially where physical activity is required. Now, research into both conditions has identified a potential relationship. Such theories will include altered lung function induced by obesity, inflammatory processes that are exacerbated by obesity, which may trigger a predisposition to asthma. We're looking at genetic factors. But one thing to know is that, however, research suggests that obesity may be a predictive factor for the development of asthma. Just because you are obese does not mean you are going to develop asthma, essentially. Alterations in lung function caused by obesity include a reduction in total lung volume, reductions in forced expiratory volume, also known as FEV1, reductions in reported quality of life. Impaired lung function can have far-reaching impacts that negatively impact an individual's productivity at work, as said earlier, in a physically demanding job especially. So the overall purpose of this evidence-based practice project is to review the alleviating factors of asthma in overweight and obese individuals, primarily focusing on the effect of weight loss on asthma.
So with the search strategy, we wanted to have a purpose of being able to determine the effect of weight loss reduction on a person with asthma and its symptoms, quality of life. So we're just focusing on that PICO question. We searched different databases, and we looked at about 30. We looked originally at 30 articles. 21 were evaluated, and 12 were ultimately selected. To search for these articles, we had words that included obesity, overweight, asthma, exacerbation, severity, lung function, quality of life, health status, symptoms, BMI, weight loss, and weight reduction.
After performing a literature review on the 12 articles that were appraised, to answer the PICO question, we found 1 meta-analysis, 1 systematic review, 4 randomized controlled trials, and 6 quasi-experiments. 9 of these articles were positive, showing results that supported our PICO question. Weight loss did improve asthma function. One of the studies was negative. It showed that there was not a correlation between weight loss and improving asthma in the patient population. And finally, 2 of the 12 were conflicting. They showed improvements in some areas of asthma, but other areas did not improve.
So there are different ways in which the interventions of losing weight happen. First one was surgical. Boulay found bariatric surgery improved airway responsiveness, lung function, asthma control 12 months later. Mandiscalo study concerned obese women and compared with their baseline function along with their asthma control and that of 1 and 5 years after the surgery. He also did a similar study later with a bariatric woman undergoing surgery and compared it with a group that did not, a control study. The results showed that the women who went into the surgery had better lung function and reported improved asthma control. Aaron enrolled 58 overweight women into a 6-month study, exercise intervention. Hakala enrolled 14 overweight asthmatic patients into an 8-week dietary intervention. Jensen's study was an RCT on weight reduction effectiveness on asthma symptoms. Boulay had findings in which the evidence supported the notion that obesity predisposed an individual to poor lung function, increased airway hyperresponsiveness, and lower quality of life. Jewell reported findings for weight reduction effectiveness on asthma. Moria conducted a systematic review on weight loss reduction impact on asthma individuals. Ciprandi did not have a weight reduction intervention, but instead compared asthma patients against one another according to weight. Logo compared children in different weight classes and found obesity had increased chances of exacerbation compared to children who were considered normal weight. Packhale studied the effects of a diet intervention as well as weekly classes to reduce weight reduction in asthmatic participants. Panlin, sorry about that, study focused on patients who were overweight with asthma compared with those who had asthma but were not overweight. Willie Bordsey conducted a randomized control study by enrolling children in education classes on obesity, dietary interventions, and regular high activity.
The strengths and limitations of the research that we found included measurable, repeatable data, baseline and post-intervention measurements, varying interventions for weight loss that yielded similar results, and findings which can be applied to multiple fields in the medical community. Limitations we found were varying sample sizes. Some were quite large, but a majority had a small population. Hospital-based populations cannot control for extraneous variables. Results are subject to human error, and self-report allows for subjective data.
All right, to kind of bring this all in, weight loss in obese populations has shown a significant increase in overall lung function and alleviation of asthmatic symptoms. One of the important things to note is continued maintenance of weight loss in obese populations can lead to further continued improvements in lung function. Now, just to let everyone be aware, while weight reduction does appear to improve lung function, it is not a panacea for asthma, so it's not a curative for asthma. And then to kind of touch on our recommendation, an improvement in lung function in obese patients is centered on weight management. So the real benefit with this is weight management can be performed in several ways, including surgical means such as bariatric surgery, performing exercise, dieting, to behavioral modifications. Due to the variety of the interventions for weight management, the most effective intervention is the intervention that is appropriate to the patient and their needs.
These are the references we used. Thank you for listening to this presentation. It is on behalf of Capital University Department of Nursing.